Now see, today we are going to see myocardial infarction. MI. Myocardial infarction. Mute yourself. Please mute yourself, all of you. It is a ischemic heart disease. What the disease? Participants, mute all of you. Sound is there. Okay, ischemic heart disease. Ischemic means what? That is the ischemic necrosis. Necrosis means death of the cells. Okay, necrosis, that is the death of the cells. Now here, myocardial infarction. Myocardial infarction, we also called as a heart attack. We also called as a heart attack. Generally, you can see all the heart attacks are early in the morning. All the heart attacks are early in the morning. Okay. So this is the medical emergency due to ischemic necrosis of the myocardium. Ischemic necrosis means death of that myocardial cell. Some parts are there. We will see later which type of this one we will see. This is also called as a heart failure. Now see this necrosis. Necrosis means what? Death. It is irreversible. It is not reversible. It is irreversible. Once damage, permanently damage. Irreversible. That's why it is emergency. It is a medical emergency. It is a irreversible necrosis of the heart muscle secondary to prolonged ischemia. That is the secondary one. But it is irreversible necrosis of the heart muscle, permanently damage, permanently death of the heart muscle. That's why it is serious. Okay. That's why it is a medical emergency. That's why it is a medical emergency. The heart attack results. Why it is? What is the main cause here? Due to the blood clot, clotting of the blood. That clot obstructs the coronary artery. That obstructs the coronary artery blood flow going to the or flowing to the or passing the blood to the heart. And that's why there is a sudden heart attack due to stopping of the blood flow towards the heart. The artery carrying the blood to the heart, there is a obstruct. There is a what we called as a obstruction, means stuck there only. The blood will not flow up to the heart. The blood flow will stop suddenly, and that's why there is a heart attack. Okay. The heart attack results when the heart attack comes when a blood clot completely obstructs. Completely obstructs means completely blockage of the artery. Completely. If there is a minute clot, then it's okay. The blood flow is there. Okay. But not that much speed. Not that much. But there is the flow. But what happened? Completely obstructs when it stucks there only due to blood clot. What happened? What happened? The heart muscle dies there only. The heart muscles dies. The heart attack results when the blood clot completely obstructs the coronary artery, supplying the blood to the heart muscle, and the heart muscles dies there only. Okay, that is the necrosis of the myocardium. This is the necrosis of the myocardium. The blood clot that causes the heart attack usually forms the site of rupture of the atherosclerotic. Where it is there, the site atherosclerotic, hardening of the blood vessel. Okay, cholesterol plaque, same. The plaque will due to cholesterol, deposition of the cholesterol on the inner wall of the coronary artery, on the inner wall of the coronary artery, due to our diet habitual. If we are eating more fatty material, fatty food material, then what happens? The cholesterol plaque will form, and that deposited into the inner wall of the coronary artery. And atherosclerotic, hardening of the blood vessels due to these high cholesterol level. This is also deposition of the cholesterol, isn't it? LDL, that is the more dangerous than HDL. Okay, so where the clot will appear? At the site of the rupture of the cholesterol, atherosclerotic and cholesterol plaque. Where it is forms, that there the clot is there. Okay. So the most common symptoms of the heart attack is chest pain, same as it is angina. Okay. If stucks the blood flow, there is a chest pain. Okay. It also termed as acute myocardial infarction. Acute, sudden. Okay. Commonly it is known as, most commonly it is known as heart attack. Okay. It occurs when the blood flow stops to the part of the heart, causing damage to the heart muscle. This causes the heart muscle to damage. Okay. This is all about the introduction of the myocardial infarction. Myocardial infarction, it is a type of ischemic heart diseases. Means what? It is a also commonly known as heart attack. Okay. It is also commonly known as acute myocardial infarction. Most commonly it is known as heart attack. Mainly due to what? Due to obstruction of the blood flowing to the heart muscle. Okay, this is the main reason. Okay, now we will see. This is again, you have to keep in your mind, it is irreversible necrosis. It will not be reversible. Once damaged, it permanently damaged, and that's why it is a medical emergency. Okay, now we will see the types of infarction. Now, what are the types of infarction? See, according to the anatomical region, according to the anatomical region. Okay, so where the clot appears, according to that one, the types of the infarction according to the anatomical region of the left ventricle inward. Okay, where left ventricle. Okay, anterior side, posterior, inferior side, lateral, walls, septal, septum region where the it divides, that is the septal region, circumferential, anteriolateral, posteriolateral, anterior septal, anterior front side, posterior inferior side. Okay, lateral side of the septal, septum, you know, that divides that is the septal region, circumferential, anteriolateral. Okay, front and side, posteriolateral, anterior sept. These are the according to the anatomical region. Okay, then next one, according to the degree of thickness of the ventricular wall inward. Now, how much the thickness? According to that, full thickness, subendothelial or laminar. Full thickness, it occupy entire thickness of the ventricular wall. All the ventricular wall it occupies. Subendothelial, that occupy only the subendothelial half of the myocardium. Okay, this is according to the degree of thickness of the ventricular wall inward. Okay. And next one, according to the age of the infarct. Age of the infarct, how much the infarction age is there. Sometimes it is newly formed, acute one, newly formed infarct, that is the acute, recent or fresh. Advanced infarct, old, healed or organized infarct. Okay, means what? Before, sometimes what happen, heart attack will come, but the patient will save, isn't it? That is, and again the second time when the heart attack comes, that is the old one. That infarction is that advanced infarct we called as a, that is the old one. Sometimes we called as a, that is the healed one, but again it reappears. Again it reappears, and this one newly formed immediately, acute, duration is less, recently formed or fresh infarct. Okay, so according to the age means what? Acute and chronic, that is the newly formed and advanced infarcts, old one, healed one or organized infarct. Okay, so these are the types according to the anatomical region, according to the degree of thickness of the ventricular wall inward, and next one according to the age of the infarct. Now we will see the pathophysiology. Now see, nicely here I described this one. Schematic representation is there. So that's why it is easy to learn, easy to understand and easy to remember. So pathophysiology, how it appears? Due to the severe occlusion, severe vasospasm and atheroma. Occlusion, bending of the arterial blood vessels. Occlusion, okay? Occlusion, severe vasospasm due to the spasm, contraction, okay? Due to the contraction. Atheroma, that is due to the clot, formation of the clot. What happened? All these three are the causes of the myocardial infarction. All these three reasons, due to that reasons, what happened due to these causes? What happened? Reduces the blood flow, isn't it? Due to vasospasm also reduces the blood flow. Due to occlusion also reduction of the blood flow. And due to formation of clot also there is a reduction in the blood flow. Okay. So what happened? Reduction in the blood flow means it appears what it causes? Myocardial infarction. And in this it causes what? Deficient pumping, decreases the pumping of the heart because reduction in the blood flow. So what happened? Myocardial infarction. There are necrosis of the myocardial cells are there. So there is a myocardial infarction. So due to that one, what happened? Deficient pumping. Due to deficient pumping, two are the cause diseases will happen. Which one? Shock. Sometimes the heart will go into the shock, or sometimes what happen? CCF, congestive cardiac failure. Congestive cardiac failure. It deficiency in the pumping means only what? Congestive cardiac failure. The cardiac will fails to pump, and this causes what? Death. This causes the death. These are the events in development of the ischemic heart disease. Which are those ones? Severe arterial occlusion, severe vasospasm, atheroma. Due to all these reasons, what happens? Reduces the blood flow going to the heart. Then what happens? Myocardial infarction. Due to this deficient pumping. Due to deficient pumping, either shock or either congestive cardiac failure, and automatically there is a death. These are the events. Understood this one, pathophysiology?
Yes, ma'am.
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Going to see the etiology. Now the causes. What is the main cause? Here only we see occlusion, vasospasm, atheroma. What is the main cause? that is the blockage in the coronary artery. Blockage, due to blockage, there is a reduction in the blood supply to the heart. If the blood supply is cut off for a few minutes also, then also there is a myocardial cells dies, isn't it? Few seconds also, few minutes also, there is a death of the myocardial cells. That is called as a necrosis. That is called as a necrosis, and that is irreversible. That is irreversible. So there is a medical emergency. So main cause is what? Blockage. Blockage in the coronary artery. Coronary artery, the artery supplying the blood to the heart, that is the coronary artery. Okay. Rarely a formation of blood clot is formed in the heart. In the heart. Okay. Sometimes directly in the heart there is a blood clot. Rarely. But where the clot appears? In the coronary artery. But rarely the blood clot is formed in the heart, directly in the heart, breaks away and gets lodged in the coronary artery. And sometimes what happens? It will breaks away, and what happens? It is lodged into the mouth of the coronary artery. So that's why also there is a what happened? Blockage, cut off the supply of the blood, or sometimes severe vasospasm. Vasospasm, vasoconstriction, sudden contraction. The muscles will get sudden contraction. Do you feel some anytime your calf muscle will spasm like anything, so that you will not move to move your leg like that? The spasm is there sometimes. Are you feel sometimes? काफ मसल, काफ मसल म्हणजे समजते का काय म्हणतो मराठीत त्याला? गुडघ्याच्या खाली पाठीमागनं त्याला काय म्हणतो काफ मसलला आपण मराठीत? एनीवन? काय म्हणतो मलाही आठवेना.
पोटरी.
हा, पोटरी. पोटऱ्या जाम होतात की नाही? ड्यू टू व्हॉट? ड्यू टू व्हाजोस्पाझम. कसं होतं त्यावेळेस?
कॉन्ट्रॅक्शन.
हा, मग त्यावेळेस काय होणार आहे? रिलॅक्सेशन होताना असं पाय असं करताच येत नाही तुम्हाला. दॅट इज द हिअर. बट व्हाजोस्पाझम वेअर? इन द कार्डियक हार्ट मसल्स. सिव्हिअर व्हाजोस्पाझम इन द हार्ट due to in the heart muscles. Okay, so that it is responsible for the myocardial infarction. And sometimes old age, all the diseases are due to old age. Okay, so that's why don't be old. Always be energetic, always be healthy. When we will old, when we are not working, if we are not using cycle also, then what happen? It will not play, isn't it? So our body is also like a machine. Use that one. Due to the old age, they are not walking, they are not doing exercise, they will stuck there only. So don't do like that. In your home also, the grandfather grandmothers are also there, no? You tell to them ki do exercise daily. You know, one newspaper, that news is there in the paper. 90 years old lady, she is an instructor in the gym. Are you imagining? Not in India, it is foreign countries. But see, she is how much year old? 90 years, but she is a good instructor in the gym. So be healthy like that. Okay, due to old age and active smoking, too much smoking. Okay, due to that so many diseases are there due to this. Hypertension, if some individuals are having already the hypertension, BP, then also myocardial chances are there, infarction chances are there. diabetes, all are one and the same. Hypertension, diabetes, high cholesterol, coronary artery diseases, all these are responsible for myocardial infarction. Okay, low physical activity, past family history. If there is a family history, then also some of the chances are there, but don't think like that. You can eradicate that one. Okay, it is possible due to daily exercise. Obesity, due to obesity there is a hypertension, there is a diabetes, there is a high cholesterol, so many cases, so many diseases are there. Alcoholic use, too much alcohol, then also problem is there. So these are the etiology of myocardial infarction. Okay, mainly blockage in the coronary artery, rarely the blood clot in the heart that will lodged into the coronary artery. If it lodged into the coronary artery, it stucks there only, and what happen, it supplies will be cut off. Okay, due to that the myocardial infarction will take place due to old age, due to active smoking, alcoholism, hypertension, diabetes, high cholesterol, low physical activity, past family history, obesity, alcohol use, and the other factors are also you see in this need the special attention. Always, if you are hungry, then don't eat anything. Healthy food is necessary. Diet, how it is unsaturated fatty should be preferred over the saturated fat. Okay, always genetics. Actually, some of the diseases are there due to genetics. That is, it comes from the parents to the offspring, but always not like that. Okay, genetics. We know diabetes it is genetic, hypertension it is genetic, the cardiac diseases are there, genetics, rheumatism, genetics. But if we will take a good diet, if we will do the regular exercise, then we can eradicate these type of the disease, or otherwise we can prolong, isn't it? So these are the factors we have to take into consideration: diet, genetics, and other factors, oral contraceptives. In the pregnant, due to these oral contraceptives, there are the chances to get these type of the diseases. Endometriosis in the woman under the age of 40. Short-term exposure to the carbon monoxide, nitrogen dioxide, and sulfur dioxide. Short-term exposure, then also we will lead to myocardial infarction. Okay, and which one? Negative emotion and social isolation. Emotions, every individual have emotions, but don't think negative. Always be positive. I used to say always, negativity comes automatically, but positivity, that is our choice. Okay, so negativity, no need to have energetic to come that one. It is coming automatically, negativity, but positivity, that is our choice. We need that practice. All the positive thoughts, always think positive, that need practice. But this unhappiness, negativity, all it is coming automatically. But positivity, happiness, that is the our choice. We have to select what we have to select that one. And social isolation, sometimes what happens, isolation is now we are in isolation, isn't it? That is also thinking, some of the individuals they are thinking negativity due to what? Social isolation. Now we are in isolation. Now some are enjoying, but some of the individuals, some they are not enjoying that one, so they will take tension. So always be happy, do not have to take any type of tension. Okay, that is social isolation. Okay, now these are the factors we have to consider that one, oral contraceptives. Don't take more oral contraceptives. Some of the ladies, they are taking, okay, to prevent the pregnancy. Endometriosis, short-term exposure to carbon dioxide, nitrogen dioxide, sulfur dioxide. And next one, that is the negative emotions and social isolation. So I kept DP. I think that is the one triangle is there, isn't it? Before mental health, actually your mental health should be good than your actual health, body health. Mentally health will promotes you, stops all the diseases. Mentally you should be healthy, then everything will is possible. So that's why what feed we require, which feed we require? Positivity, happiness, always think positive. You read that book, Rahasya or Secret, The Secret. Okay, so how to think, how to come the all the time, every time positive thoughts, that is there. Okay, so symptoms we will see. Here myocardial infarction is more common in the early in the morning, okay, than in the late evening. Always you keep in the mind. You are seeing also early in the morning only the heart attacks are there. Okay, symptoms we will see during the onset of the attack. Now feel, if you will pull, if we will contract the muscle, contract the blood vessel, then what happen? You feel like that. How we feel? Shortness of the breath. Okay, fatigue is there, and then chest pain is there, intermittent, and then these exertional angina a day or weeks before the attack. Sometime there is a exertional angina is there. Before coming this attack, the patient was suffered from this exertional angina. Exertional angina weeks or day before. Okay, these are the symptoms during the onset of the attack. Okay, during the attack, what happens? Severe pain in the middle of the chest and may spread to the back, jaw, left arm, especially left arm. Okay, which cannot be relieved by rest or nitroglycerin. Sometime we will puncture this nitroglycerin tablet capsule below the tongue so that it will directly dissolve into the blood vessel and immediately we will get the response. Okay, this is the nitroglycerin NTG tablet. Okay, and what happened due to all this one? Anxiety. Obviously there is a anxiety because of severe breathlessness. Due to that breathlessness, restlessness will happen. Due to that restlessness, sweating appears. Due to that sweating, fainting or dizziness or giddiness is there. And due to all these symptoms, the patient will anxiety. The patient will causes what? Anxiety will develop. Okay, fear will develop. And what happens? Palpitation, heartbeats will increase, pulse rate will be increased, isn't it? Abnormalities in the heart rate or in the blood pressure, fast heart rate, that is tachycardia, or sometimes slow heart rate, bradycardia. Flushing is there, that's why what happened? Bradycardia is there or slow heart rate is there. And all the time nausea and vomiting. Okay, and oliguria is there, less urine formation. Okay, or frequently, little only, low grade fever. Okay, sometime, and blue lips and hands. Why the blue lips and hands? Anyone?
Low oxygen.
Low oxygen, sir.
Because there is a cutoff of the blood. Cutoff of the blood flow. So what happened? No oxygen. So what happened? Blue lips and hands. These are all about the symptoms. Okay. during the onset of the attack and during the attack. Are you understood? So feel that one, go deep into that disease, then and then only you will feel that disease and write the symptoms, what happened, what will happen, so that you will directly write the, once you understood, then and then only it is possible to write all the things. Okay, understood all these symptoms? Now we will see the diagnosis. Now we will see the diagnosis. Which are the diagnoses are there? Before that one, 20% of the patient do not experience. 20% of the patient do not experience any type of the above symptoms. Without symptom, they only pass away because they can't tell to others also. Suddenly, that is called as a silent heart attack, where only the ECG can indicate the onset of attack. Sometimes mild heart attack are there. They will not feel any type of all these symptoms. But what happen? If we will take out the ECG, then we can understand, then we can indicate there is a onset of attack. Means सुरुवात झालेली आहे, starting of the attack. Sometimes what happen, first attack they will save, okay, save their life. But sometimes what happen, if sudden severe heart attack is there, they will, without feeling or without anything, they will pass away. Okay, so sometimes 20% of the patient mild heart attacks are there without any type of the symptoms. But if we will take out the ECG, that ECG will tells us the onset of attack. Okay, now see the diagnosis. Whatever we have seen in the yesterday angina, same the diagnosis is there. Okay, so we will not repeat here, simply we will repeat little bit, not in the deep. Physical examination, obviously every disease physical examination is there. What the doctor will examine here, what the examine here, the kind, which type of the pain is there, which type of the pain is there, duration of the pain, they will ask the individual. Who will ask? Doctor will ask. Doctor will check the pulse rate, heart rate, examine everything, blood pressure they will check, isn't it? The other they will check here. Okay, these symptoms the individual has to have to say all the symptoms to the doctor. So that's why the doctor will indicate, the doctor will come to know which type of the in which type of the disease the individual is suffering from, isn't it? So duration of the pain in association with the other factors like exertion, due to the exertion the pain is there, or due to the meal, or due to the climate. Meal, if we will have more, then also there is a pain. Okay, pressure will increase, isn't it? Climate, cold climate, then also the patient will suffer. Okay, the individual will suffer. ECG, electrocardiogram, electrical signals. Due to that one, we can indicate. Blood test, certain enzymes are there. Due to that, we can understood which type of the disease is there. Okay. Chest X-ray, only we will see here the images of the heart, lungs, everything. Here we will see only the enlargement of the heart. Okay, nothing else. Echocardiogram, echo, that is the sound waves. Okay, sound waves to produce the image of the heart. Again, more and more images of the heart we can take out, and so that here we will completely understand the areas of the heart muscle, which areas of the heart muscle is damaged. Okay, coronary angiography, same. Okay, like that only. But what here, again we will take out the more pictures. Here echocardiogram, sound waves we are using. Chest X-ray, only we will take the X-rays. Here in the ECG, electrical signals are there. But what is there in the coronary angiography? dye we can pass. Okay, and due to that dye, we will, after that one, we will take the X-ray, so that we will take the images, series of the images we will take, so that the picture will clear again which type, which blood vessel, which artery will get damaged. Okay, cardiac computerized tomography, CT scan. Again, here we will take the more images of the heart. Okay, we are going little fast because day before yesterday and in the hypertension, both the times we will explain in detail. Okay, so we are going fast. Radionucleotide image. So imagining here also the magnetic, due to that we are taking the more clear picture, so that we will clear to diagnose which part of the area, which area of the heart will are getting damaged. Stress test, we are using here treadmill or pedaling stationary bicycle, same as it is. But why? What is here? ECG we are taking during the stress test. BP monitoring we are taking during the exercise. Exercise means what? The patient should, the individual should walk on the treadmill or pedaling a stationary bicycle, and in that situation the in the lab they will take the ECG and simultaneously they will monitor the blood pressure. Okay, nuclear stress test, here what happened? In this we will measure the blood flow to the heart muscle at the rest and during the test, both. Okay, special scanner is there, and due to that also the images of the heart muscles we will take. Radioactive material we are inserted, due to that one the what is there here, the light spot will sparkle, so that's why we can take out the pictures and we will clear more which part of the area or which area of the heart muscle damages or which area or which part of the artery damages. Now treatment, aspirin for what? Actually it is a anti-inflammatory drug, analgesic drug. Okay, but aspirin, it is also prevents the platelet aggregation and hence clot formation. Means actually we are using this one aspirin in the corona also. There is a viscosity, increases the viscosity of the blood. So to lower the viscosity, we have to take aspirin. Okay, so there is a suggestion to take the aspirin. Okay, it prevents the platelet aggregation. Thrombolytics, thrombus means clot, lytics means what? Breakdown. What it will break down? Thrombolytics, thrombus, clot, breaking of the clot. So the drugs that are called as clot busters helps to dissolve the blood clot. Whatever the blood clots are there, small, if we will give the thrombolytics, they dissolves the clot and free flow of the blood is there. Okay, streptokinase, urokinase. Okay, antiplatelet agents, they will stops the aggregation of the platelets so that it will prevents the clotting of the blood. Okay. Anyone wants to ask me anything? Pain relievers, chest pain is there. That's why we will give the pain relievers. Morphine injection, if there is more pain, then centrally acting painkillers, that is the morphine, we will inject. Okay, to get relief from the pain and discomfort. Okay, why you are leaving the meeting? For whom I am taking this one? Only 40 are there. Why? Are you getting, are you understanding, or are you feeling bored?
No, ma'am.
No, ma'am.
Then why are you leaving the
ma'am.
meeting? Or your range of data of completed data? Maybe there are chances, isn't it? Now see the beta blockers. Don't by heart these things, okay? Only 2-3 drugs for this level, first year level for pathophysiology, more than sufficient. These all I given just to see and just only 2-3 drugs, that is sufficient, okay? Beta blockers, they were blocking the effects of the hormone epinephrine. Epinephrine, adrenaline, these are the sympathomimetic drugs. They increases the heartbeats, okay, due to that one adrenaline, release of the adrenaline, okay, heart rate will get increased, so that's why there is a blood pressure, okay. We will see in the next time in the pharmacology. As a result, the heart beats more slowly and less force, thereby reducing the blood pressure, okay. Beta blockers also helps due to this, beta blockers. What happens here? Hormone, what will cause? Epinephrine and adrenaline, more heartbeats. But due to blockers, if we will block the hormone, these hormone, there will be slowly decreasing. Okay, blood pressure will also get released. Okay, so that's why the individual can get the relief. Okay, beta blockers also helps to blood vessels relax. Means only what? If there is due to release of the adrenaline vasoconstriction, they causes due to blockers, they causes relaxation, vasodilatation, okay, and open up and improves the blood flow, okay. Now AC inhibitors, okay, surgery, last option, angioplasty and stenting. We will place the what spring here, okay. Day before yesterday we explained nicely angioplasty and stenting, okay. What we will, balloon we will keep, and due to that balloon we will keep, it is easy to keep the spring, okay, stainless type of spring. So that's why if there is any bending of that blood vessel, it will open, okay, due to that stenting, due to that spring, stainless steel spring is there. It is also called as a percutaneous coronary intervention. Okay, a tiny a tiny balloon is inserted into the narrowed artery. A balloon is inserted into the narrowed artery, and a small wire mesh, that is the spring, is usually inserted into the blood vessel to keep open the blood vessel. Okay, this procedure improves the blood flow in the heart and reducing and eliminating the angina also. Okay, coronary artery bypass surgery. Bypass, if there is this way is blocked, we will take the another way, bypass, that is the coronary bypass. Prevention, what you will prevent? You know the causes, so that's why you prevention is better than cure. What you will prevent? Avoid smoking, drinking, and you have to exercise regularly. Okay, you have to exercise regularly. Get regular medical checkup. Control your blood pressure and cholesterol level. Maintain the healthy weight, maintain the healthy diet, manage the diabetes, control the stress. Okay, due to all these, we can get the good health. Okay, now complications, secondary symptoms. If we will not treat, obviously what happen? Complexity will happen. Okay, the second stage will happen, the other diseases will happen, the other organs will get damaged, isn't it? So heart failure may be possible, ventricular fibrillation, arrhythmias. Arrhythmia means what? Abnormal heart rhythm. Dub lub dub lub, isn't it? This is the rhythm of the heart. But how much? 72 beats per minute. That also in equal distance, isn't it? But if this rhythm is not in a way, in a equidistant manner, then what happen? Arrhythmias, change in the rhythm. Okay, sometimes fast, sometimes slow. That is, there is no any rhythm is there. So that's why it is called as a arrhythmia, abnormal heart rhythms. Okay, heart rupture. Due to that, all these things, heart will get rupture. Wall problem, wall inside the heart, walls are there. Due to these all pressure or more pressure, the wall will be sometimes damaged. That is the wall problem. Okay, so this completes our myocardial infarction. So we will see the memory points now. Is it visible slide? Slide, is it visible?
No, ma'am.
No, ma'am.
No, ma'am.
Okay, I will share. Now,
No, ma'am.
अरे बाप रे. Okay, now I will share. Now, is it visible?
Yes,
Yes,
ma'am.
ma'am.
Now see, these are the memory points. Okay, we have to keep into your mind. Okay, keep into your brain. Myocardial infarction, cardiovascular disease. It is also called as a heart failure. It is also termed as a acute myocardial infarction. Most commonly, it is called as a heart attack. Most commonly, it is called as a heart attack. It is a medical emergency. Why it is a medical emergency? Due to the ischemic necrosis. Due to ischemic necrosis, death of the myocardial muscles, and that is also irreversible. That is also irreversible. So that's why it is a medical emergency. A heart attack results. Why? When the heart attack will result? Blood clot. Due to blood clot. This causes the completely obstruction of the coronary artery. Completely obstruction. Keep here your attention. Completely, what I told here, completely obstruction, not a single. Completely obstruction coronary artery supplying the blood to the heart muscle, and the heart muscle will die. Okay, the common symptoms of the heart attack is chest pain. Okay, angina, in angina there is also a chest pain. Now see the types of the infarction according to the anatomical region. According to the anatomical region, and next one according to the degree of thickness of the ventricular wall. Okay, next one according to the age. What is the anatomical region? Anterior, posterior, lateral, septal, circumferential, anteriolateral, posterior-lateral, anterior-septal. Okay, and according to the degree of the thickness. Full thickness will involve sometimes subendothelial or laminar region only. And according to the age of the infarct, sudden, acute, or recent or freshly. That is the newly formed infarcts. Second one, the advanced infarcts means what? Older one, healed one, or organized type of infarction. Etiology, prime cause, that is the blockage of the coronary artery. Due to that, what happened? Reduction in the blood supply to the heart. Due to formation of the blood clot. Sometime what happen? This clot will form into the heart, but it is rarely. Always the clot will appear where? In the blood vessels, but sometime, rarely, the clot will appear in directly into the heart. And what will happen? This clot will lodged into the coronary artery. Sometimes the opening of the coronary artery into the heart. The opening, due to this blood clot, it will obstructs to flow of the blood into the heart. Okay, so severe vasospasm, contraction of the blood vessel due to the old age, active smoking, hypertension, diabetes, high cholesterol level, coronary artery diseases, low physical activity, past family history, obesity, alcohol use. Okay, all these are the etiology of this myocardial infarction. Now we will see the special attention we have to give diet, genetics, and other, that is the oral contraceptive, endometriosis under the age of 40 years of, in the women, shorten the short term exposure to the carbon monoxide, nitrogen dioxide, and sulfur dioxide, negative emotions, and social isolation. Myocardial more commonly in the early in the morning. Okay, symptoms onset. During the onset of the attack, what happened? Intermittent chest pain, shortness of the breath is there due to vasospasm. Shortness of the breath is there, fatigue is there, exertional angina a day or weeks before sometimes. Okay, during the attack, what happened? Severe chest pain is there. This will go further, move to the jaw, back, left arm. Okay, and then anxiety is there, fear is there, restlessness, sweating, dizziness, giddiness, fainting, palpitation is there, more heart, that is the tachycardia, or sometimes slow heart rate or bradycardia due to less supply, and abnormalities in the heart rate or blood pressure, nausea, vomiting. These are the common every time. Okay, oliguria is there, and low grade fever is there. Okay, so we completed. Diagnosis is there. Okay, blue tip lips and hands are there. Blue lips and hand due to less blood supply. Diagnosis, which type of the diagnosis we will do? Physical examination, ECG, blood test. Here in the blood test, what will we will take into consideration? Some of the hormones or enzymes will be released into this myocardial infarction that we have to check out by blood test. Chest test say echocardiogram, coronary angiography, CT scan of the heart, radionucleotide imaging, stress test, nuclear stress test. Okay, treatment, 2-3 drugs you have to keep into your mind: aspirin, thrombolytics, antiplatelet agent, pain relievers. Okay, surgery is there, coronary artery bypass is there. Prevention, what you will prevent and due to what we will take care, that is the avoid the smoking and drinking. This is the prevention. Exercise regularly, it is not a prevention. Okay, do exercise regularly, get regular medicinal checkup, control by doing all these preventive measures. By taking all these care, we will prevent these type of disease. How we can prevent? By avoiding the smoking, by regular exercising, by regular check-upping, by regular check-upping of the blood pressure, cholesterol level. Okay, by maintaining the healthy weight, by eating the healthy food, by managing the diabetes, by controlling the stress, we can prevent these type of diseases. Okay, now complications, secondary one. What will happen if we will not treat properly? Heart failure, ventricular fibrillation, abnormal heart arrhythmias. Means only what? Arrhythmia. Okay, arrhythmia, abnormal or change in the rhythm. That is the arrhythmia. Heart rupture, valve problems. Okay, these are all the complications if we will not treat properly. So we will stop here only. We completed today the myocardial infarction. Okay, understood all of you?
Yes,
Yes.
ma'am.
Yes, ma'am.
Shall we stop here only?
Yes, ma'am.
Okay. Good night, all of you. We will close our meet.
Yes, ma'am. Good